Welcome, and thank you for joining our pandemic response and panel discussion. We want to keep this session interactive, so remember you can use your chat over on the right-hand side of your screen. I'll take those questions and I'll pass them on to our moderator, and he'll be asking them to the panel as we go through this session. So let's get started. We have a panel of national and international emergency management professionals that have joined us today. They're going to share their insights on the pandemic and their recovery and response activities that they performed. Our panel is moderated by Daniel Gleaves from Pantex. Daniel serves as the Senior Director of Pantex Emergency Services. He has 20 years of experience at Pantex, all in serving in emergency response-related positions. Daniel holds a Bachelor of Applied Science with an emphasis in business from Wayland Baptist University and a Master of Business Administration from West Texas A&M University. Daniel, the floor is yours.
Thanks, Paul. Thanks for the introduction. To kind of set the stage, and Paul, you hit it off right. Really want this to be an interactive discussion among the panelists, also receiving questions from all the attendees that are in Attendify, just to keep this very interactive. We want to use the best of our time and really share all of the pre-planning, all of the response, and then all of the recovery that we've all had to do as emergency management and continuity professionals during the COVID pandemic. I really don't have to explain the COVID pandemic. We've all been living it here in the United States and also globally for a year and a half or longer now. So really kind of the focus of this, and hopefully it'll take shape as we go through the panel discussion, is determining from our panelists, representatives from throughout the DOE complex and then also the United Kingdom, what pre-planning was in place, what worked from that pre-planning, what didn't, what were the lessons learned, how did the response go, how did the recovery go, and really kind of work through the process of COVID response from A to Z, hopefully. And like I said, attendees and Attendify, please ask questions. There will be a Q&A session at the end of this. Depending on how quickly we get through the list of questions that I have for the panel discussion, we may have up to 15 minutes for Q&A at the end. But to keep it interactive, I do request that you throw very time-sensitive questions into the chat. Paul will get those over to me. If we have the chance to stop right then, we'll stop and ask the question for our panelists to address. So before we get started, what I'd like to do is just very briefly introduce all the panelists, and then have the panelists give each one of them give a very quick bio to lend some credibility from the perspective of how did they control response or participate in response to COVID for their perspective side. So like Paul said, we do have experts from throughout the complex. We'll start with Dina Siegel from Los Alamos National Lab, Bradley Dickerson from Sandia National Lab, Amy Basche from HMIS COO. She's the HMIS COO for, hold on, I've got it, Hanford Mission Integration Solutions. Sorry, Amy. Justin Goehring from Y12, as well as a couple of participants from the UK from the Atomic Weapons Establishment, AWE. We've got Martin Wells and Scott Hearn. So we'll just start at the beginning. Dina, if you'd like to kind of give us a little bit of an overview of your experience and your position there at Los Alamos.
Sure. Thanks, Daniel. So I am at Los Alamos, as Daniel said. I'm biosafety officer. I'm chem hygiene officer. I've been in management. I've been a field industrial hygienist. And for COVID, as a biosafety officer, it really enabled me to really delve full-time into biosafety for a while. So my role in this was to work with our own emergency management division on bio. I also work with them on chemical issues as well. but primarily to ensure the safety of workers during that COVID-19 pandemic, including our testing and analysis of workers, our on-site workers. We have research personnel. My background before Department of Energy was Department of Army. I was a consultant for industry and government. I was a contractor at Rocky Flats. Have several certifications, and I guess that's good enough for now. So I will pass the baton back to the next one, Daniel.
Yeah, so next up we have Bradley Dickerson, and I say Bradley, you may go by Brad, so you could start out with that. So,
yeah, thank you. I do go by Bradley. Thank you. It's perfect.
Good.
So my background, I've been at Sandia for 3 years. I run our global chemical and biological security group here at Sandia. We do cooperative threat reduction on chem bio issues around the world. I came here, I've spent most of my, I had background in research in the biosciences before. I've done stints at CDC and Office of Public Health Preparedness and Response, and at the Department of Justice National Security Division. And but I think most relevant to what I've been doing here is I was at the Department of Homeland Security as the Senior Biodefensive Officer for 11 years. And so I did a lot of pandemic planning starting back in 2007 with when President Bush had his the H5N1 related pandemic plan all the way through, of course, we dealt with H1N1, Ebola, Zika, numerous other things. So I did the infectious disease stuff from a Homeland Security point of view and a lot of consequence management planning, working with our partners at FEMA. So during the pandemic, my role has been as the pandemic coordinator. So I reported directly to our SLT, our senior leadership team, and most directly to James Peary, our laboratories director, and coordinated all of the things that we did for response to this pandemic. And so what we tried to do was implement a lot of the things that were in our national and actually the DHS plan from going back to 2007, 2009 time frame, and then what we've learned since then. So happy to join this discussion. Looking forward to it. Thank you for inviting me.
Great, Bradley. I appreciate that. Amy, I'll pass it over to you.
All right, we're working some technical issues, so hopefully you can hear me.
Yes, ma'am.
Okay, perfect. So I'm Amy Basche. I'm the Chief Operations Officer here at Hanford Mission Integration Solutions, and we are the site integrating contractor. There's about 11,000 employees on site with 6 different contractors, 2 different Department of Energy offices. And in that role, I was tapped as the COVID queen to kind of help ensure that we were aligned in our approach. With that many workers and with that many contractors, it becomes really easy to have different programs and approaches. And we wanted to ensure that we were going together in a coordinated effort. It was really my main function. The EOC, which really was a hub for us in this pandemic, served as, I'll say, the cornerstone. They report to me. And so that's kind of how we were engaged and involved in all things COVID. And I would like to say that I was hopeful that we were coming out of it, but we are right back in the thick of it here at Hanford and Washington State. So look forward to the discussion. Thank you.
Thank you very much. Next, we'll turn it over to Justin.
Hey, Daniel, thank you. My name is Justin Goehring. I'm the Emergency Preparedness Manager at Y12. I've got a combined experience of about 21 years in fire, emergency services, EMS, hazmat technician, law enforcement. Been at Y12 for roughly 16 years. I'm also the COOP coordinator at the site. I don't know that I would say that I was the COVID king here at the site, but I've had my hand in a lot of the different groups. Namely, we started off with our MedCon team when the pandemic essentially started off. We transitioned to what we considered the pandemic team. Then we transitioned into what was known as the vaccine team. And now we're transitioning into a whole new plethora of things that are coming down the pike. So with that, I represent Y12. We have about 9,000 people here on site between contractors and direct hire employees. And for those that aren't aware, our sister site, Pantex. I've worked hand in hand with Daniel and all of his fine group of people at Pantex throughout this entire thing.
Thanks, Justin. I appreciate it. Yeah. So, and to very quickly kind of give my background from the perspective of COVID, it's a good opportunity since Justin brought it up. Since Pantex and Y12, our sister sites, really had the opportunity to work very closely with Justin throughout the response. We really had very similar roles at each site. I would not say we're the COVID kings, but I sure am glad we do have COVID royalty on. So, Amy, I appreciate you being on. Next, we'll go across the ocean. Martin, if you'd like to introduce yourself.
It's nearly 8 p.m. here, so it is evening for us. So I'm Martin Wells. After 24 years at AWE Aldermaston, I'm now heading up our site control division, for want of a better term. So that group entails the emergency response teams, the business resilience teams, our 24/7 site safety shift who look after and run the business when everyone else has gone home, and our health physics teams, which are the RADTECs that you would call. So since COVID started, we've been running what we call a DSM cell, a duty site manager cell, to manage the response on behalf of the business, reporting direct into the exec, into the CEO. And since January of last year, I've been partnered up with one or other of the DSMs throughout the whole event. So we're now 18, 19 months through this. The AWE response has been pretty much in line with the UK government. So given our structure, we are very much expected to align with the government responses. So we haven't veered very far from the standard approach. And my role really has been setting standards within the organisation, a big part on communication, getting the understanding of how the business needs to respond and getting that out to the members of the teams, and working upwards into DNO, the Defence Nuclear Organisation, our equivalent of the DOE and NSA team, and also to our Public Health England teams, which are the equivalent of the CDC, I suppose, so that we take advice where required and feed information out into them as to how strategy and political direction to a degree is affecting us and the risks that introduces to us. And I'm very pleased to join you all.
Very good, Martin. I appreciate your participation. So finally, Scott, if you'd like to introduce yourself.
Yeah, good evening, good afternoon, everybody. My name's Scott Daviews-Hearn. My role at AWE is the lead for AWE emergency planning preparedness. So ensuring that the AWE emergency response infrastructure integrates, delivers how we interface with the off-site plan and protection of the surrounding community for our sites. Historically, my background has been in emergency planning and environmental geology, so I've worked in consultancy, local authority, so your state's level, and also back within Ministry of Defence at DSDL Porton Down, so a background in CBRN. I've been providing support, so I work for Martin. As I said, I look after the emergency response infrastructure, so my role under COVID has been ensuring the emergency response arrangements can best facilitate guidance, policy direction. In general, I imagine the same activities that you've been undertaking. So it's actually implementing those requirements on the ground and feeding back. So it's a specialised component supporting Martin in the COVID cell, as you just mentioned. So short and sweet.
Very good, Scott. I appreciate it. And I appreciate everybody's attendance today and help with this this panel discussion. So like I started the discussion, I'd really like to get the flavor for the overall response from previous to COVID through COVID and how that was adjusted, and then really how we've started the recovery from COVID. So With that being said, I really kind of want to get the flavor from as many sides as we can. What level of pandemic planning did you have in place? Was that pandemic planning useful in response to COVID? And were there any lessons learned from either sufficient planning or lack of planning that could be directly used for COVID? So I know that was a mouthful, but really what I'm looking for is what you have in place and did it work for you in the beginning of COVID? We'll start with Dina. So Dina.
Sure.
Yeah, go ahead.
So,
kick this off.
Okay, great. Yeah, so I'm assuming like everybody else on this panel, everybody had a COOP plan. They had a continuity of operations plan, and ours was updated on an annual basis. And I feel like the COOP plan was pretty good. We follow the and I know our COOP coordinator was not on this call, but we follow the DOE requirements. It actually was a very solid plan and really didn't need, it enabled us to immediately switch to what we needed to do. So immediately going from 100% of people on site, basically down to a fraction of that while trying to get mission essential work continuing. So it was from a COO standpoint, it was good. We also had a pandemic response plan, which and a pandemic advisory team, as well as a pandemic task force, which morphed into our COVID task force. And I will tell you, for us, not really truly having the details and knowing what was going to happen. The previous pandemic that we had done this on in terms of some of the previous pandemics that were around, really, as far as I am concerned, didn't really prepare us completely for what we were going to be faced with SARS-CoV-2. So out of all of those things, I think that the biggest thing that we looked at and are changing as a result of the pandemic was our pandemic plan. So we did realize it was updated, but as we actually started to look at COVID, taking in all the information that was happening on a weekly, daily, sometimes an hourly basis, having that COVID task force, which has our occupational medical director, myself, our senior ESH managers, our HR, legal counsel, our communication professionals, all of our chief operating officers, our policy office, our COOP program lead, and all of our emergency management personnel. We're really part of that, and including things like creating a COVID hotline, a 24/7 hotline that was staffed to answer questions, do our contact tracing, communicate with me and our COVID response team for decontamination. All of those types of things happened with us. And when we were determining what response actions needed to be done, we used a combination of DOE and, since we are an NNSA site, those NNSA requirements, the CDC recommendations, mission requirements, and then all of our subject matter expertise, not only within Los Alamos, but reaching out to our peers at other sites to see how people were doing things. Looking at what is now very familiar to everybody, which is social distancing, face coverings, respirators, on-site presence, things like that. So it was an incredible challenge overnight to go from greater than 12,000 on-site to greater than 10,000 teleworking, and having that, basically that skeleton crew here. We also established a special office for COVID-19, which was focusing on the scientific and technical capabilities in several key areas. So we have modelers. So modeling in supportive response, those modelers are actually used by CDC and DOE in a lot of other aspects. Setting up our laboratory testing options. So we actually had and still have an on-site testing laboratory that is CLIA certified that runs our PCR samples for all of our folks that we test here at LANL. We were looking at application of artificial intelligence or AI and machine learning and how we could do that. Looking at medical countermeasures and also involving our high-performance computing aspects to do that. So we took several actions for our personnel. One of the first things we did was put in mandatory employee training, and this is where I just want to give a shout out to all the other sites. We initially worked with Lawrence Livermore, who I know is not on this call, but they had a great set of training. We used that as kind of our template to continue our training. Reviewing all our activities prior to the start of activities with a COVID focus. Implementing the COVID controls, which I know everybody is familiar with. And then part of our preparation was making PPE, face coverings, hand sanitizers, disinfectant immediately available in our warehouse. And as I know everybody knows, that was a bit of a challenge at the start of the pandemic. Making sure we had N95s for our medical personnel, any other appropriate personnel that needed those N95s. So our respiratory protection program administrator was working very hard to make sure we had that. And I also, one of the things that we did early on was this early case identification and containment. We wanted to get that done, have those contained, making sure we had people isolated as soon as we could, which is why the on-site testing for us was so important.
Yes, Dina, I appreciate that. I don't mean to cut you off, but you're going to steal the show and take it away from everybody.
I'm sorry.
No. All great stuff. No, it is all great stuff, and I am sure that we're going to get there, and all right. Some of those response actions that the rest of the sites may provide will probably align with yours, but I appreciate that. Real quickly, before we move on, I want to get two more perspectives. Justin, focusing back on what plans you had in place and did they work for you? If you'll take that question.
Yeah, Daniel, and to go off with what Dina was saying, we had an infectious disease and pandemic plan. Now, that plan wasn't a step-by-step guide to, if faced with this, do this. It did give some of the DOE levels and the MedCon levels and how those would align and things to take into consideration, but it wasn't a technical procedure, so to say, as a step-by-step process. The one area where it really helped the most, though, is we pre-identified who made up the MedCon team. And then once that MedCon team was assembled and brought together, that's where you started filling in all the blanks and all the go-dos, so to say, that came from the ever-changing guidance and recommendations and things to be aware of. So the plan didn't capture all the changes, but it laid the groundwork on who we would bring together to manage all those changes.
Very good. I appreciate that. So the other perspective I want to get in, and Martin, either you or Scott can jump in on this. So you heard Dina at the first, and then also Justin talk about a couple of plans that we have in place, and those are really driven from our continuity of operations requirements. I want to get your perspective from across the ocean. Did you have pandemic plans in place? Are those requirements of the contractor to have in place, and did they work for you?
So to answer the first question, yes, we did have a plan in place, and yes, it forms part of the what was the contract. We've now changed our construct with DNO, and we're now effectively a part of the DNO, so we're no longer a contractor to the DNO. But in terms of our original contract, yes, we were expected to put in place business continuity plans for a multitude of foreseeable events. So we had a pandemic plan, but the pandemic plan that we established largely focused on the on-site impact of people becoming unwell. And very early on, we realised that actually the likely damage to the business would come from outside in rather than inside heading out, if that makes sense. We were more likely to be impacted by the fact that the hospitals nearby weren't able to operate and support us and take our casualties were we to have a major event, or the fuel infrastructure breakdown, etc. So whilst we had a plan, it didn't really survive first contact. And had to be really quite heavily revised as we went through the first month or two of our planning of the response. So yes, we had one. If we had our time over again, we would have probably changed it quite considerably prior to the event. But now we've got an opportunity to take the learning from this.
Very good. So it sounds like, I mean, at least with the sampling that we've had in this panel, we all had plans in place, but it really didn't fit what challenges COVID would present. So,
Daniel, if I could just make just a quick statement on that. So I think, and this is something that we struggled with at DHS back in the 2006 timeframe when we were developing our plans for pandemic there, is that a COOP plan, we had a COOP plan, a pandemic COOP plan at Sandia, but COOP for a pandemic looks much different than COOP for most any other events. And so when we pull off our COOP plan, we look at it, it goes down to just the mission essential functions. But many of the functions we do here are very essential to other parts of the government and to national security. So we didn't go down to below, I don't think we were ever below 20%, probably more like around 30% during the time, because we quickly, moved away from just a traditional COOP plan. But I think that's a lesson learned, is that a pandemic is a different type of COOP situation.
No, I agree with you. And I do think there were quite a few lessons learned on what were critical operations that were needed to support the government, even those that didn't necessarily support PMEFs or MEFs. So I think that's a great point, and hopefully we'll get to that part of the discussion relatively quick. I do want to kind of shift focus on a word that became almost my nemesis here at Pantex, but triggers. So I hope across this panel we all kind of understand triggers. So multiple times throughout the pandemic, I was approached on really mathematically, what is a trigger to implement social distancing, to implement mask usage, to implement maximum telework, which became very, very hard to identify what that trigger was. And I think in the beginning, we were all in the same position. Maybe our pandemic plans had certain percentage of absenteeism before we went into a continuity response, but COVID didn't fit that mold. It became very political at first, and it really low numbers of infections caused alarm and trigger amongst senior leadership. So, Bradley, if you don't mind, I see you nodding your head. Will you jump in there and talk us through triggers, how you established them, if you established them, and really your perspective on that?
So, yeah, triggers, as someone who did federal planning for a long time, particularly in this health sciences, that you try to stay away from triggers. You try to talk more about a scenario that you would start the decision criteria, but not a definite trigger. Because you on a pandemic, you want to look at things like the case fatality rate and the attack rate. And these are things that we can model and get numbers much better, quicker right now, but those numbers aren't really that good. And so you don't really know what the true case fatality rate really is until 6 months to a year after that date, because you get all the information in. And so many of the national plans that we've had in the past have been tied to case fatality rates. And so I remember in 2009, H1N1, everybody's kind of looking around and saying, so what's the case fatality rate? What do we do? You know, because we pulled out our national plan and we couldn't fit it in. And so that was the same problem here. If you have senior decision makers, they're like, okay, tell me when to do this thing. When do I implement it? And so what we did was, I think it's not basically, maybe it's not a satisfying answer to a planner, but for a operational person that's pretty good, is you have a common operating picture. You make sure that your SLT and your leadership understand what's going on, and you take the best. And in this case, we take the best science that we have and formulate a decision for them to implement. So it was something that we couldn't say that, you know, once it hits this case fatality rate, we're going to do this, or this attack rate, or this many cases per day. Because you don't really know that until it's kind of a sliding, you know, till later. So you try to come up with a common operating picture to get your decision makers all on the same page to make the decisions they need to make. But also, if you look at the decision space, so sometimes the triggers, the decision space, it's a binary thing. You can either, you know, tell people to go home or stay here. And so it's not so graduated. And sometimes that people were wanting triggers because they're thinking that they have a much more finely graduated decision space. And I don't think that we had that in this pandemic most of the time.
No, I agree with that. Out at Hanford, Amy, do you have anything to add to the discussion about triggers or setting standards or levels on your response?
Yeah, so, you know, we were primarily driven here in Washington State by governor's orders, you know, which really drove a lot of decisions for us in terms of max teleworking. We had, as part of our COOP plan, while we didn't officially, I'll say, implement the COOP per se, the COOP still drove us to go to what we called was a MinSafe structure, and people are designated by that as an employee. So while we were able to go to that phase literally overnight, again, similar to what Deanna and others had said, where you had, you know, 11,000 people on site to 2,000 on the next day, we had done some pre-testing in our IT space, et cetera, to allow some of that to happen. Of course, our bargaining unit was the challenge. And so, you know, keeping them occupied and working through that approach was probably a larger challenge for many of us. But we were able to maneuver our way through that. And then I'll say the triggers for us really came when we worked through our remobilization plan. How do we safely remobilize workers back to the field? And that's really where we identified, call it a trigger, call it a metric on what would the community numbers need to be? How many people could we have within facilities, even following all the safe social distancing rules? Those are the pieces where we really worked on. How do we deal with, right now, I will share at Hanford, we're dealing with kind of a resurgence here in Washington State. We have a very low vaccination rate. And so we're seeing the unfortunate ramifications of that. So again, we are maximizing telework. We have a tracking system and a lot of metrics that we continue to evaluate and review every day to the senior management staff across the Hanford landscape so that everybody is well informed on what the numbers are sharing and if we need to go make any adjustments. So while there wasn't anything specifically identified as here's a trigger that we would be monitoring, we have created those in order to effectively, I'll say, affect the safe posture of the site.
No, I appreciate that very much. So you'd mentioned a couple of times max telework, and I think we've all lived through max telework and probably all have a different vision of what that means. I do want to focus on that capability, understanding that, you know, with a COOP program, telework is a piece of that. But the telework that we've experienced over the past year has been to levels that I'm pretty sure the majority of IT organizations really could not handle. So I would like to focus a little bit on telework, focus on how you were able to implement max telework, what IT adjustments were needed, and how quickly did those come about. So Dina, I'll jump back over to you and let you talk through telework there at Los Alamos.
Sure. One of the things about the telework versus on-site work is we definitely had mission requirements that we needed to be on site for. So, for instance, our plutonium facility never really went down. We did social distancing, we did COVID, but there were some things that we just had to be on site for. We had deliverables that we had to meet. So that being said, those who could telework did, and yes, it was a huge burden on our IT staff, but they did an incredible amount of work to not only make sure that everybody could remote in securely, that we had the necessary both ergonomic and IT considerations at their home offices. Just an incredible amount of going, from that 10,000 to that 12,000 on site to 10,000 teleworking. So there were definitely some glitches. People who didn't have, for instance, government computers at home, trying to work safely and securely through that was an issue. But they did they because I was one of those that was mostly on site because I was the COVID lady. I think COVID queen would have been better, Amy. But for those of them that were able to do that, we basically got things going, and now it is a well-oiled machine, I have to say. So that part's really good. We also, as a result of all this, implemented a formal remote work pilot. So we have some people that are continuing to work remotely, even though, well, at least until about a couple of weeks ago, we're able to come back on site and work. So and just kudos to our IT staff for doing that. And supply issues. So you guys probably know that getting laptops in, getting computers, getting those types of things became an issue for all of the sites. So enabling people to work from home was really our primary goal. And I do have to do a shout out to our ergonomists as well, because they gave a lot of good information so we didn't have ergonomic injuries while people were working in their home offices.
Perfect. Justin, do you have any information to share with the group to kind of elaborate on how CNS approached telework?
Yeah, and it was a struggle on the front end. I mean, I don't know if anyone had it all figured out on the front end, but we had a lot of folks that didn't have laptops. They may have had personal laptops, but they didn't have GFE devices. Of course, if you're going to go off site and come into your site network, you got to have a VPN token, and that was a huge limiting factor on the front end, was getting the bandwidth, the support for the systems and the VPN tokens so people could actually work from home and come back on, and actually be productive off site and get into and I'm not a tech guy at all, so there's probably people like, this guy doesn't know nothing, but, to be able to come into the firewall and actually be productive on your own personal files and your own personal, intranet, so to say. Well, that infrastructure didn't exist on the front end, but kudos to our IT teams for how they responded with getting people up to speed and doing all the things that had to be done. And of course, the other side is, exempt employees were able to telework, but non-exempt and a lot of the bargaining unit employees weren't able to. So they essentially went home just to keep them safe and their families safe. And then there was others that had to work every day based on their exempt status, so to say. So that was an interesting avenue to work through.
I do think that's going to be a pretty good discussion here in a minute, specifically about operations and what operations, how did we arrive, or how did the panel arrive at the decision what operations would continue, what wouldn't, and how we worked around that. I would, though, we've got a good opportunity having Martin and Scott on here, just a different perspective on telework. Martin, was telework prior to COVID? Were you able to test and get people out?
No, I mean, very, very driven by COVID, our changes. I mean, the position prior to COVID was nobody worked from home. absolutely, we had no teleworking whatsoever. Very early days, we did a trial with our. We've moved on to a network that does allow for Wi-Fi access using VPNs, etc. So a large number of staff already had mobility within the site, and they could move around, use their laptops at various locations and that sort of thing, but very little use at home. So in March of last year, we did a trial. So one of our normal working Fridays, we asked a large proportion of the staff to go home and try just working from home, see whether the infrastructure coped with it, whether the VPN would handle it and so forth. And largely it did, but it needed some work to strengthen it. But that put us in a position where only those with laptops were able to go and telework. And there were numerous other staff that could have been productive to an extent from their houses, but without a laptop. So our ISIT teams put together I'm trying to think, a portal effectively into our official network, so our lower grade network that you could access from home devices, personal PCs, so anything running Windows 10 or a reasonably up-to-date Android system was able to port into the system. Very limited functionality, but it did provide access and communications, which was one of the key ones. When we'd followed the guidance and asked people to go home, those that weren't critical to our day-to-day operations, one of the things that we learned very early was that we need to be able to communicate with them. So let's keep those channels open, and what we call the Ozone Virtual Desktop allowed that to happen as well. So it meant that we could keep them informed, tell them what changes we were making on site, what controls we were putting in to keep things safe and so forth. So that was very important to us. But no, very, very steep learning curve as far as the IT teams were concerned. We had plans, and it's become something of a facilitator for pulling those plans forward. So had COVID not happened, I don't think we would have moved quite as quickly as we have done. But ultimately, from September, October of this year, we're moving into a position where there will be teleworking as standard for a large proportion of our staff. So it was really a catalyst for that to happen. At the moment, out of on a normal working day pre-COVID, we had about 8,000 people on our sites, spread across the two sites. At the moment, we're at about 4,000 to 5,000 across the sites. So we've got somewhere in the region of 2,000 AWE staff who are still teleworking. The government position only changed on the 19th of July. So in the UK, those that could work from home must work from home up until the 19th of July. So there wasn't much in the way of choice on that. Those that couldn't could legitimately go into their workplace, but if you were able to work from home, you had to work from home. That's now relaxed, but AWE has changed our stance slightly, so we moved that date forward by 4 weeks. So we're insisting that everyone who has been working from home stays at home until the 16th of August. That's partly to allow us the time to adjust the infrastructure on site. So we've, as a country, we've moved away from a legal requirement to social distance. When that was implemented last March, April, it meant that we had to vastly reduce the capacity in any of our offices. We couldn't put people desks next to each other and that sort of thing. So there was a little bit of moving around of furniture and that sort of thing, but also a lot of marking off of territories that could and couldn't be used and so forth. So we've got some work to do to undo that over the coming weeks prior to the 16th of August, when effectively we will reopen the site to anyone who wants to access it. But at that point, those that are working from home will be able to continue to work from home if it suits them to do so. So it'll go from being a mandate to what's best for them and best for the business moving forward. So yeah, definitely a catalyst, and it's been quite a challenge to implement up front, but it was a direction that we were heading in anyway for certain groups.
Thanks, Martin. That was a great segue to really the discussion I wanted to have. Martin, are you muted?
Yes.
Thank you. Yeah, that leads me to the next discussion. I want to just pull the list. Maximum telework was a key component of our response to COVID. With the resurgence of COVID, specifically the Delta variant here in the United States, is your site still at max telework? And if not, are there any plans to move back towards max telework to get people off of sites? And we'll start with Bradley.
I'm sorry, it broke up. Did you ask me?
Yes, sir.
Okay. Good. Are we at max telework? I don't think we are at maximum telework, and so we have a significant teleworking footprint. And so the way that we did it before is that basically in the first couple of weeks, we sent a lot of more people home. But basically, if you can work from home, you should work from home. And so we've maintained that, but kind of loosened that up a little bit so that folks could come into the office. But I think many people will come into the office but not stay in the office. If you need to do some classified work, you come in and do your classified work, or certain things that you do. Now, with Delta variant, will we stay at that? It's a little bit too early to say right now. I don't know. We've implemented the new masking rules. We are making sure that we're doing as good as social distancing as we can. Trying to the same things that we've done so far will get us through Delta. If you're ill, stay at home. And so we came up with this health check app to help people understand if they're symptomatic or something, they need to stay at home. So if we keep people at home who are symptomatic, and if we have 100% masking, and we get as many people as we can vaccinated, I think that there won't be a need to go back to maximum telework. But I think that we'll watch the data as it comes in, and we'll try to be responsive as we can.
Very good, thank you, Amy. How about up in Hanford?
Sure. So we're similar to Brad. We're in a hybrid, I'll say, stage, right? So again, we have all of our field personnel, our bargaining unit are all remobilized. And so, they require the supervision, work planners, but we are allowing people to, similar to what was just mentioned, if they need to come on site to do a specific job evolution and then go home, we're allowing them to do that. So we're right now at about a 60-40. So we still have about 40% of the work site teleworking. And as some of the others have said, we really, for many of us, our companies are going to continue to support a longer term posture with regards to telework, because again, the forcing function drove you there, and you now realize what you can accomplish when you were forced to go get there. So we will always, I suspect, have some range of teleworking. We are really not seeing an impact of, I need to go bring another 100 or 200 people back. We're really ebb and flowing different people on and off the site to preserve and maintain work activities and evolutions. And I think you're going to continue to see that. Like I mentioned earlier, we are seeing a resurgence here in Washington State and in our local community. So we are continuing to remind people that they certainly have that opportunity to telework and are encouraging that. But there are just some job evolutions based on where we are that, people are going to have to be flexible and come in and then go back out. So again, trying to preserve their safety.
Thank you very much. Justin, how about Y12 and speak for CNS?
Are we maximized telework? No, we're not. We have a lot more people that are coming on site. We have a lot of people that work on the red side that really can't do that type of work from offsite. So there are some folks that, as we're still in the pandemic protocol, that they're maybe only coming in 1 or 2 days a week. But no, I would not say that we're in maximized telework. But I want to back that up with, we're also keeping metrics. So in those metrics that we're tracking, one of the very biggest ones here is We have active cases at CNS, which includes Pantex and Y12, but we're also tracking on-site transmission. So, previously, Daniel, you brought up triggers, so to say. Do we have a specific trigger where on-site transmission is going to become a problem? I don't know if we have that clearly defined at this point. However, we are tracking that and watching that to know if, okay, as we bring more people on site, more people are here, are we seeing on-site transmissions increase? And the fact of the matter is, we're not. So we're trying not to get caught up in some of this sensationalization of this, and we're actually looking at hard data to make sure we're making educated decisions with our workforce based on that data.
Thanks, Justin. So we'll end the discussion on telework with you.
And who are you talking to, Daniel?
To you, ma'am. I apologize.
Oh, thank you. That's okay. I didn't hear the end part. So, yeah, everything that everybody else has said here, we're also dealing with. So, normal operations, it is maximized telework, but we are using a term called 100% efficiency. So, if we really need people to be on site, so think about health and safety, RAB protection, all of our craft, all of our subcontractors that are working on things that support the mission is part of what we're doing. So what people are slowly getting back to pre-pandemic levels to a certain point. I also wanted to say also that we have a challenge. Our Los Alamos County is pretty small. It includes the laboratory and town site. And a lot of our workforce come from the surrounding counties. And those surrounding counties have different infection rates and other types of things that we have to take into account when our workforce comes back on site. So we also are doing, have implemented the revised masking requirements and are looking at what we have on site in terms of cases, both positive cases and potential cases. So I think that some level of teleworking will remain, and those that need to be on site will be on site, and that's our current status.
Perfect. Thank you. So what I'm going to do right now, and it's purely because the moderator needs to take about a 5-minute break. We're going to break for 5 minutes. I want to kind of tee up a discussion that I'd like to go through when we come back. So we've all mentioned COOP several times. I really do want to ask the question, was this a COOP event, a COOP incident? Go through that discussion and then talk on operations and the new terminology that we probably all learned, mission critical operations as it relates to mission essential, and really have that discussion for a few minutes after we get back. So I'm showing it's 2:23. We'll start the conversation back up in 5 minutes at 2:28. All right, everybody. I hope everybody's come back to join the Pandemic Plan Lesson Learned panel discussion. When we broke, we were just about to jump into operations. What operations did you continue? And then continuity of operations discussion. But before we get there, there was a question in the chat box. How did disaster recovery plans play into the planning and execution of the COVID response across the complex? Did sites have business continuity plans to rely on as well? So I would like a couple of the panelists to field that question. Really, Amy, I'll turn to you, and I'm kind of hitting you blind with this, but really, did your disaster recovery plan play into the planning and execution? And did your business continuity plan, was that a good resource for you to rely on?
Sure. So again, I would say that we use them as intended, right? They were guides, and while they may not have been the perfect fit for a pandemic, we certainly ensured that the attributes that are described in some of, specifically the business ones, made sense in terms of what we were doing. I think the biggest struggle was everything was moving very rapidly, and it was a matter of being able to sort through all of the various different criteria. That coming from, I'll say, DOE headquarters, local municipalities issuing their guidance, state mandates, and how did we manage all of those collectively and communicate it and make sure that we were doing the right key components. But again, I think while we at Hanford never, I'll say, officially declared this to be a COOP event, because we were able to go and perform all of our mission essential work, no different than we would on, when you have a national blizzard that's biggest that we've ever seen, right? We have people who are designated essential workers, and those people all came into work. That gave us some time. The key was, how long can you maintain in that capacity, right? So we were able to maintain in that capacity for a few weeks, and then we slowly started bringing other key workers and work elements back while we had time to go do the proper planning. So we used them absolutely as a guide to ensure that nothing was missed, especially considering, at least on the business side, 99.9% of those people were now off teleworking. And so ensuring things even as basic as all the banking structures and all of that were also off teleworking, we're still working and moving forward was an important piece. At the end of the day, what's important to people is that their, automatic deposits are a very important thing to them. So there were some key business functions that we needed to make sure worked, and even the timekeeping systems, right? So again, with that many people off site, specifically our bargaining unit team, who really, many of them did not have access to either personal computers or offsite ways to connect into the system. So being able to communicate with them regularly and get time recorded appropriately was really instrumental in what we needed to go do. We had a little bit of a luxury here at Hanford where we had a few communications tools. We actually have an app that's ran from our Emergency Operations Center. So we were able to update the app every single day to give people ease of access on their phone to kind of give them the status of what's taking shape at Hanford, and any other notification that needed to be put out there we utilized that EOC app, because we've kind of trained our folks that if you hear it go off, please pay attention. And so, people really started paying attention to the communications, and that was one way we knew we could connect and touch a lot of people.
Yeah, so that's very interesting. And I kind of want to get your perspective, or not necessarily your perspective, how Hanford responded. You mentioned the app for communications to be able to talk to people offsite. Is that app part of your emergency operations system? Did you use that? Did you use your EOS and or activate your EOC?
It is. So our EOC, as I mentioned earlier, was kind of the hub. So all of our COVID reporting, because we, again, wanted to be consistent in terms of how we were tracking individuals who were being tested, who had tested positive, what facilities we were cleaning so that we could close facilities. We were then notifying of every facility that perhaps was restricted due to being closed for COVID cleaning protocols. And the app that we had created really is a user-friendly approach that most workers at Hanford knew if the app goes off, there's something I need to pay attention to, right? And so we decided we retooled it very quickly to add some simple capacity to it. And the EOC team just really knocked it out of the park to be able to ensure that we were being transparent with our folks and being able to get information out very quickly. Now, on the reverse of that, I will tell you, after a while, they were on app fatigue. People just stopped listening because we were updating it so often with various different notes. So we had to then scale back a little bit and go, okay, while it worked initially, it got to be a little bit then overload, and people then just stopped paying attention when we really did we were worried about if in the event of a real emergency, have we now, made these people insensitive to the alarm panel that's coming off of that. So we had to retool it as we moved along, but it worked great initially for the communication step. We then had to retool it to limit what was going to be shared on it. But what we did do was create a couple of easy, quick buttons where people could click and then they could launch to a website at any time of the day to see what facilities are restricted. So it just wasn't being, I'll say, updating the app to where there was a formal notification. But it worked great. And I think our people appreciated that we were being very transparent with what was taking shape out in the facility at all times. So I think it benefited us greatly.
Thank you. That's great. Martin, I'd like to jump over to you and really kind of focus on your emergency operating system or tools that you would use during an emergency. Did you find those useful during COVID? Did you use other tools? Activate your emergency operations center? Any input from that perspective?
So no, we didn't activate the EOC, as we call it. The team running the COVID response were more based around our business resilience team, but supported by the emergency response team. So we've been working with them on a weekly basis to understand what the status of their capabilities is. But that's how that's being affected by COVID rather than actually managing the response per se. So heavily engaged and on board with the response, but then they're not. We didn't set up that response in that way. Partly thinking because if we had a real problem on the site, we didn't want those resources already fully mobilized and fully engaged in managing a pandemic response, which was a threat to the business continuity rather than a threat to the safety on site per se. So.
Very good. All right, to shift topics here a little bit, and we'll start with you, Bradley, because you talked about this, I think, in maybe one of your opening answers to a question. Operations, mission critical operations there at Sandia that no joke had to continue. How did your senior management team or your continuity team or Sandia in general identify what operations needed to continue and how to continue those operations?
Thanks. Well, so certainly we looked at the mission essential functions, the defined mission essential functions, and those were sacrosanct and kept going the whole time. But I think that, and this is interesting to me coming from Homeland Security over to Sandia, that MEF is a real term of art here at DOE. And then, so there was a bit of a problem with, what's, I think the way you're using mission critical now to be more in a more general sense. And so I think that we never thought that we just had to do the MEFs. We thought that we could manage the consequences and mitigate the risk and continue to do the things that we needed to do, that we were called on from either Department of Defense or state or whoever. And so and when we scaled down, we did it in a way that we could continue to do all of those things. So I don't think that we missed any major, or I don't know that we missed any mission deliverable. The things that we missed out on were things, like safety training and a lot of the training and stuff that you need to keep going from day to day to have a good facility. That's what got cut out more. But the mission stuff, we really didn't scale back that much on. So. And that was a lot of the conversation. So I'm I'm probably making it sound a little bit more rosy than it did in the first month to 6 weeks. So we did scale back pretty strong in that first couple of weeks, but then I think that we felt like we were able to move it up enough that we could do all of these, what I'm loosely calling mission critical functions now for all of our partners.
Great. Dina, from your perspective at Los Alamos, how did y'all determine what operations continued?
So we actually used this approach, for the monitoring the principal mission essential functions to really look at that early on. And it really meant that we call it mission essential staff and mission essential support staff. So we looked at that, and we looked at what our deliverables were, what we promised in terms of NNSA, what we needed to get done, and we agreed that we were going to get those done, and we were going to get them done safely. So part of what we did for those mission essential functions was to make sure that our responsible line managers actually walked through all of those activities step by step, looked at where we could easily do COVID controls, where we needed to implement controls, and whether we needed to modify some of those activities to make sure that we were protected in our COVID control approach. So we looked at really those impacts to critical mission work and mission essential work, analyze those impacts, and then make sure that as we did that, the responsible organization did what they needed to do that work safely. It was really kind of part of an overall approach to making sure we could continue to meet our deliverables. And I do have to say we did so, and we did it safely. So really pleased with the way that our responsible line managers worked with us, with our emergency management division, and our medical folks and myself to do this so they could continue. I do have to say one of the challenges was ventilation, and I don't know if you're going to get to that, but that's probably something I'll talk about if we get to lessons learned.
Yeah, so we will get to lessons learned, and I'll speak specifically for Pantex. We had challenges with ventilation also. And it sounds like the journey that Los Alamos went down, and also Sandia, CNS, Pantex and Y12 also went down. There was an initial surge of sending people offsite while ensuring that we could continue to do our mission essential functions. So keeping those critical positions on site to, with lack of better terms, keep the lights on, ensure we had a fire response, ensure we were safe and secure, while we figured out what those COVID controls for each individual operation that we wanted to bring back on board needed to be. So I would presume that the majority of sites had that same kind of evolution, initially sending off everybody except for mission essential function folks, and then very quickly determining COVID controls that could be implemented, bringing those operations back once it was safe to do so, and continuing the mission. Because at the end of the day, we all have customers, DOD being one of them, which is a very critical customer and critical mission that even during a pandemic must continue. So we'll move on to the next line of questioning, and really what I want to focus on are any out of the norm COVID controls that you may have implemented. So we all, mark squares on the floor or put up plastic dividers. And I know this is kind of a general question, but I'd like to ask a few of y'all if there was any ingenious things that y'all did to ensure that you could limit the spread of COVID on site. So Justin, I'll start with you.
I couldn't make my own salad in the cafeteria, Daniel. That was the biggest impact for me. So, I say that tongue in cheek. I mean, I'm sure everyone was masking, distancing, going virtual with meetings, trying to keep the distance. I guess one that would be when we had areas where maybe there was some on-site transmission or suspect positive cases, and my mind just went blank, but the Clorox 360 machine that we would bring in and spray down not only a work area, but the common areas, that was probably one of those that was very beneficial, Daniel, that I can think of off the top of my head.
I appreciate that, Justin. And I'll just kind of open it up just for a few seconds. If any of the other panelists want to chime in and really tout some ingenious measures that they put in place.
Hey, Daniel, this is Dina. I'm not sure that this is ingenious, but we did kind of track things. We used a GIS-based application to track our spatial spread and distribution of cases and vaccinations across sites and across buildings. So we were able to see if we had, quote, hotspots, looking at them in terms of ventilation or other types of things. So I want to just throw that out as something that we did as well, in addition to the predictive modeling that we were doing.
No, that's great. I'd like to take a look at that. Bradley, I saw you wanted to chime in.
Yeah, I don't know about ingenious. I wouldn't say that we were ingenious, but there's we've had public health around for a long time. And so we implemented basic public health measures. And the most important thing that you can do is if you're ill or may be ill, don't go around other people. And so very early on, and our IT department did a fantastic job of this, is we developed an app that a lot of folks have apps right now that you put in some questions about your contact history or possible exposure history and symptoms, and you do that every day and take your temperature. And based on the algorithm we have, if you strike positive on any of those, you're just told to stay home for the day. And then there's an automatic ticket generated for our medical unit, and so medical will reach out to you during the day to talk to you about your exposure. And so then we may schedule a test for you, or we may just say stay home tomorrow and take the app again and see what it says. And so I think so we implemented this layered defense, but that is the most important and critical layer of the defense. And so anyway, I was pretty happy with that app, and I think it helped us a lot.
No, that sounds very, very cool. So one thing that we struggled at Pantex with, specific to employees performing screening and not coming to work if they have any symptoms, was really kind of defeating culture that has been ingrained in the workforce that, hay fever type symptoms, you should still come to work. So defeating that perception, and I will tell you, specific to Pantex, multiple times we had employees come to work with what they thought was hay fever and turned out to be COVID and potentially exposed coworkers. So defeating that culture of get her done and come to work, it has been difficult and continues to be difficult. With that being said, I want to jump to the next topic. We really only have time for maybe one or two more topics before we go to a round robin lessons learned. The next topic I want to jump on is recovery planning. Did your site develop a recovery plan? Did you do that before the DOE reentry and recovery plan was issued? And then how did that impact your recovery plan? I see Amy doing a lot of head nodding, so I'll start up there with you.
Yeah, so we actually did, in coordination with our local field office, have what we call them remobilization plans. We went through them weekly with the department and identified very specific job tasks and the number of people that we'd be remobilizing. And primarily that took place kind of from, I'm going to say, the June through September timeframe, because our goal was to get at least all of our bargaining unit folks redeployed by September. Again, here in the state of Washington, we were under a little bit different, I'll say, governor's orders in terms of stay home, stay safe. So we had that to maneuver around. But we reviewed those plans weekly so that, again, there was no misunderstanding or surprise about the number of people that we'd be remobilizing to the site. Making sure that our OCBED providers are training, because again, a lot of those things were delayed for people. So ensuring that we maintained a qualified and trained workforce, as well as our OCMED provider was heavily engaged in how we remobilize that team back. And then similar to many of you that you've talked about, right, is how we monitored and measured any type of resurgence that may take place in any specific building. Again, we track by building number so that we had a metric that said if there was more than 2 people in the same building that had tested positive within 7 days, we may need to go look at something different. So again, all of that was part of a remote prior to the DOE headquarters or anything coming out. And it was very much in line with what we were doing, but it was a little later than we could at least afford to do. So we were, I think, ahead of that curve a little bit. And it worked well for us, and all the contractors participated here at the Hanford site.
Very good. Justin, from a Y12 perspective, did you develop a recovery plan? And once the NNSA phased reentry and recovery plan came out, did that cause any changes? And have you executed that recovery plan?
Yeah, the pandemic team, as we got together with, and especially with the involvement with Occupational Health Services and NPO, we came up with recovery plans and what that looked like for bringing people back on site and the cleaning function, so to say, and keeping everyone healthy, as well as, what did we want to tell the workforce, what was expected, how were they to act and operate prior to showing the work. And as we would develop those recovery plans, we obviously had to have NPO involvement, but we also had to see what DOE and CDC was recommending. And there got to that kind of weird window where we were essentially saying we were going to phase 2, but DOE was at a level 1, and I'm not saying that correctly, but you know what I'm referring to. We were kind of at a different level between our sites than what DOE was saying the national pandemic level was, so to say. So that was a bit tricky navigating that on. We were bringing people back and had a lot more people coming to the site and working. I hate to use the term normal ops because we're still not technically in normal ops, but a lot quicker than some other sites as well as the federal government. So that's my piece on that.
Great, I appreciate it. Okay, so just because of time, and I want to tell you, we probably went through about half the questions I had for you guys. So great discussion. What I want to do for the next 15 minutes or so is go to each one of the panelists. And if you don't mind, please tell me 1, 2, 3, a handful of the most important lessons learned that your site has identified through the course of the COVID response. So Bradley, I hate to say it, you're first up on my screen, so you're first to go.
I've got to draw a blank right now, but so I just reiterate that I think that the issue with MEFs and the continuity of operation plans, I think you had one thing you were going to ask earlier was this an actual COOP event? And so, every day it's a COOP event and that you want to continue operations. But in pandemics, I think that since they're a disaster, they're often thought of as in the same terms as an acute event, like a hurricane, earthquake, those type of terrorist attack. And so, but it's a completely different thing. So when you try to apply that model to a pandemic, it doesn't really work. And so kind of switching the gears on that. And so that's why you can't just pull a COOP plan off the shelf, a traditional COOP plan off the shelf and make it work for this. I think one of the things we struggled with a lot and still struggle with is the thing that you talked about was having ill people stay home. And so we set a really low bar with this app to keep ill people home or possibly ill people home. That's been a struggle. I think the biggest struggle overall has been the same we're struggling with across the world is the mis and disinformation around COVID-19. And particularly at the beginning of the pandemic, the extremely mislead or contradictory information that we were getting from our own federal leadership and then from our scientific community, where those two things weren't in lockstep, and that made it difficult for us to, I lead a group of bioscience experts, and so they kind of understood what was going on. But we have some folks that are really, really smart people, but don't know the biosciences, and you're hearing these different mixed messages about what you should be doing and how serious this event is. And so just the messaging around that was critical. And I think that it was difficult, and it continues to be difficult in places where we see vaccination rates much lower than they should be. So this surge that we're seeing right now, we should absolutely not have. We have what, if you look at the history of medicine, are close to silver bullets. I mean, we know that if you wear a mask effectively, that it is extremely effective against the virus. And these vaccines, particularly the mRNA vaccines, are extremely effective against the virus. So, but we still have even at Sandia, we have a sizable fraction of our population that's not vaccinated. And so that continues to give us operational problems in our ability to deliver mission. I'll stop there. I'll stop there.
No, it's great. Great insight. So next, Martin, and then and while we're with AWE, Scott, if you have anything to add to Martin, then feel free to do so. So lessons learned for us.
So a positive, I would say, from the whole process that we learned as we went through it in terms of what we call cohorting. So we were seeing particular groups, particular organizations within the business where there was limited resilience in the team, and potentials for fairly big impacts. So we have our own on-site fire and rescue service, for example. I talked about my safety shift team, which operate 24/7, and there's the emergency management cohorts as well. And one thing we identified fairly early on was how can we protect them best? And the best way to protect people is keep them apart. So our fire service have people, in the term we use is stood down. So basically while they're on shift, they're available to work, but they're not on site. So should we have someone taken ill and not able to attend the site, we've got a reserve, we've got someone on the sidelines that we can ship in at very short notice, available to step in and cover the role. So we've managed through the last 18 months not to have an impact on our overall capability through the fact that we've been cohorting. And we have had to call on them on a number of occasions. So it hasn't been something that we put in place and that didn't need. It really worked for us. And we are still doing it. July in the UK, as those that have been watching the news, I'm sure will have seen, was probably our worst month for COVID infections, and particularly for isolations as a result of COVID infection. So in the UK, the legal position is if you're a close contact of someone who has tested positive, then you must isolate for 10 days. That has scope to really hit the numbers available to us in a very short space of time. And cohorting has protected us from that to a very large degree.
Very good. Scott, anything to add for the UK? You're not, I think you're still muted.
Scott was having connection problems. I don't know if he still is.
He may be. I don't think anybody's getting audio. I apologize, man. So we'll move over to Amy.
Yeah, so again, some of the similar ones that have been shared, but first and foremost, our big thing that it took some time to get our supervisors and even some of our leadership term is, we're really trying to manage the emotional side of people, and giving them a very detailed technical question or response doesn't really solve the problem. And so it really took some learning from many seasoned leaders that you are not going to solve what was a highly emotional issue and sensitivity to people with a very detailed technical question. And some people just weren't in tune to that mindset. So that was a big lesson learned that we had to get over really very early. And then as we have struggled, and one of the lessons learned, and we have a very rock solid OCMED team here, but the contact tracing component, similar to what's been mentioned, really has, I'll say, hurt us in terms of the volume of people on some cases that have been contact traced, and the consistency of that is something that we continue to deal with as we've seen the resurgence. And And you sit there and go, how does one person have close contact with 12 people in a matter of an hour? And our team is very conservative, and rightfully so. But that piece has been hard for many individuals to wrap their head around. So there's still some lessons learned in contact tracing, I think, to deal with. And we actually are doing it for the entire site. We had a memorandum of understanding with our local health department to do that, which has been very helpful, because we struggled out of the gate with COVID, because the health department, of course, no different than many of us, they weren't prepared to deal with the volume. And so they were very delayed. And so the fact that we were able to do that on site certainly made our people feel more comfortable, and it became more timely. And then as you had mentioned, the whole struggle, of course, last winter, and as we head back into this fall, the difference between COVID, cold, and flu continues to be a struggle. And it's interesting, you have a mindset of worker who are like, I'm fine, I need to come to work, yet I've been told I can't, who do I call? And so we kind of get the mixed bag, and managing our way through that certainly is something that has been a challenge for us. And we have some lessons learned on how do we communicate better. I would say one of the lessons learned too is more isn't better in terms of communication at this stage. We are hearing from a lot of our folks when we're out boots on the ground, just walking and talking around with some of our folks, that they are so inundated with data. And not all of it is good data. And as you mentioned, Brad, a lot of misinformation is out there. And so, I don't know what the right answer is and where that fine balance is, but right now our folks are on data overload in terms of the control sets changing, vaccinations are good, bad, and different. And so I don't know the right answer how to manage that, but that's certainly a struggle that I know we're facing here.
Yeah, I think we all face that. Scott, I'll give you another opportunity. Maybe you've gotten your technical difficulties fixed. Nope, not that time. Okay. All right, we'll move over to Justin.
Daniel, really to reiterate on what Amy just said, in the very beginning, some of the challenges were what metrics matter. What data matters to the site, to our local community, to that headquarters wants to know? How consistent is that information? Our team with Bobby and Amity and yourself and Robert G and Aaron, the amount of metrics that we created till we really got to what people needed to know and what they meant, because it's not just how many cases there are. It's what does those cases mean? Amy brought up the misinformation. Making sure we had consistent messages with what went along to our employees that you would hear on the news sources. Daniel and I had a meeting right before this meeting to talk about what a fact sheet from the White House means and how we move forward with that with unvaccinated employees. And that'll be the next panel discussion, I have no doubt, for next EMI SIG on once you've got to the point of those who are going to get vaccinated or vaccinated, then what? That'll be our next panel, or it should be at least. But other than that, the way we utilized EMINs, the way we got our comms and our occupational health services, our Bobby Carlton and company with looking at the way we looked at this from a COOP perspective. We can all argue back and forth on whether it was or was not a COOP event, but the fact of the matter was we used COOP planning to look at this event. Having the right resources on the front end, janitorial resources, supplies we were fighting for the same supplies that the local community was fighting for sanitizer and disinfectant wipes and all those things. So can you carry a bench stock to cover every pandemic? No. Could we have had maybe a little bit more better planning? Possibly. The vaccine distribution. Wow, what a mess that became. And not from a success standpoint, but Texas had different rules than Tennessee did. So every week we were being asked, well, Pantex is giving vaccines. Why isn't Y12? Sandia did this and Los Alamos is doing that. And, across the states, it was we learned very quickly those were hard questions to ask, because some sites had an excellent vaccination program, and ours was probably one of the slowest ones at Y12, just because of the way the state of Tennessee decided on vaccine distribution to the site. We also brought in some CCON components and COGCON and looking, okay, is CCON affected? Is COGCON part of this? We've got the MedCon piece. We've looked at COOP, all those things that had to be evaluated. And then really the last one was the mission essential functions versus mission critical activities. And there was things that we said were mission essential that weren't impacted, but we weren't actively working because in the program we were ahead of schedule, or there was programmatic decisions that didn't require us to do a certain thing, but there was other mission critical programs at the site that we diverted resources. So those were all a lot of the lessons learned on how those interchanged, who was reporting that information to headquarters. Was it the program managers? Was it the COOP coordinators? And that was a hard pill for a couple of us to swallow, that on the back end of this, the COOP coordinators weren't actually giving a lot of that information concerning the MEFs. It was program owners. So I'll stop there, Daniel.
Yeah, and I think that'll be our first question, specifically the channels of communications on MEFs and then COVID data up to headquarters. So we'll finish the lessons learned with you, Dina.
Okay, so I would say the number one lesson learned was the importance of creating clear instructions, clear communications, and showing demonstrating support for on-site work. And like everybody else said, it's in the midst of changing external guidance, requirements, sometimes waiting on DOE for something, and then once we've done something, having to pivot to make sure we had captured 1 or 2 points that they hadn't. So having a flexible policy, having cross-organizational interaction and feedback was really, really important, and we improved that as we went. Worker communications were key, and I know everybody on here has talked about different types of communications, but we did all sorts of ways. We did WebExes. We had a COVID web page. We still do. We had socially distanced outdoor meetings where we could talk to people in person. We had emails. We did phones. We did one-on-ones. We did training. We gave people some our employee behavioral health resources. We gave them that. And the lesson for me was it really takes everybody to do this. It's the senior leaders. It's floor level workers who are doing the work. It's we have something called Worker Environmental Safety and Security Teams, our WEST. We have subject matter experts. It really just wasn't any one person. So that was one lesson learned. The second one was, like I mentioned earlier, realizing that ventilation is key. So the easy stuff was easy, the masks, the sanitation and cleaning. And I'm not saying it was easy, but it's easy compared to looking at ventilation, increasing and improving ventilation in some of our buildings that are literally Manhattan-era buildings. So that is still a challenge. We have a challenge with the not fully vaccinated. We have been taking all sorts of approaches, having talks, offering incentives, but talking to people at this point where we're down to about the last 13 or 15% of our site workers who are firmly in the camp of I am not going to get a vaccine is very hard. So that, I think, is still a lesson learned in progress. And then you asked for personal stuff, so I'm going to tell you one thing, Daniel, and that is, so I'm a certified industrial hygienist. I'm a certified safety professional. I'm a certified biosafety officer. And so the initial information on wear a mask didn't sit well with me from a data standpoint. And it still doesn't sit well with some of my professional peers out there. The other thing that was good to think about and just open up and look at it from a different perspective is from an infection control standpoint. And it was nice to be able to meld biosafety, infection control, and operations into one cohesive, although sometimes it wasn't always cohesive, approach to how we do things here. So those were my lessons learned.
Very good. Okay, so we'll spend the last 5 minutes or so on questions and answers. Paul, I'll take the first one. I believe you sent from Lombard out in Nevada. What group or organization on your sites were responsible for the COVID reporting requirements to headquarters? So really just kind of looking for a couple of sites to discuss their comms with headquarters. Justin, you're smiling. I'll let you go first.
I'll go, Daniel, but I was smiling at something unrelated.
I don't want to put you on the spot.
Our comms with headquarters, we were putting out the gating criteria summaries every week. And, we submitted, between us and Pantex, we submitted one CSR basically saying MEFs were not impacted. Things were not working necessarily at optimum, but we had the ability to call in. So that was really the only CSR we had ever put in. But we were giving the information on a weekly basis on the greater Knoxville area and the Pantex counties on what the active rates were, the normalized rates, positivity rates, on-site transmission. And that was being kind of rolled up in that weekly gating criteria summary, so to say, that was asked for. Every pandemic team meeting that we had an NPO representation. Our field element was in every meeting. Our field elements management team was in every meeting. So between the contractor and NPO, NNSA, and also as an enterprise with Pantex, we were lockstep. The first couple of weeks, we had some differences on where we were at the sites, but after that, we were pretty well lockstep. And I think that's been a good news story with how we would give that information to headquarters and what we were doing at both sites, and to mitigate and to keep doing the mission essential functions and the mission critical activities.
Yeah, I'll add to that just a little bit. It was a lessons learned and very interesting from a MEF perspective at all of the different lines of communication. So prior to COVID, my thought would have been that, status of MEFs, and we're an NNSA site, so status of MEFs would be flown up through NA40, through the Emergency Management and Continuity Office, and then that would get brought further. It was very interesting to me that that programs, NA10 was requesting status of MEFs, NA80 was requesting status of MEFs. There were just multiple lines of communication throughout the organization that was going up to headquarters, which from my perspective, from a site perspective, one, presented a challenge, two, presented a risk. Are we saying the same thing in all lines of communication? So I think from a department perspective, that's a great lessons learned for the future, is really establish what those lines of communication are going to be, and have, a single belly button, if you will, to be able to pass on information from the site through the field office up to headquarters. Amy, do you have any perspective on headquarters communications?
Yeah, so we created I'll say kind of a short-term position. So our EOC is doing the majority of the reporting at the headquarters level. The tracking of names and numbers and case IDs, until they decided to stop that. So we still kept track of that. But I'll tell you how those cases got closed in the system became an unknown for a while, and then all of a sudden we get a report out that says you have 1,200 open cases, and we're like, we have no idea what that means. So it really was a challenge, and then the difference between what they were pulling off of, I'll say, state and county data, which was, is very delayed. There's some footnotes in it, but unless you really understand and have access to the very detailed background of the data, you can, I'll say, get a false conclusion. And so having to reiterate and explain that to why we perhaps reported something differently because we had more current data than some website that was perhaps, 3 days old and waiting to get updated became challenging. So we did a lot of duplication, as kind of was mentioned, and And I'm not sure, for what purpose at the end they ended up using it for, because that wasn't very well communicated to. And I get everybody was in a learning mode for a long period of time at the beginning to kind of work through what was needed. But we ended up creating some Power BI dashboards that, at least at the site level, were updated daily so that at least our, field office managers and our exec management team across the site was seeing and using standard data. We listed right on there what the data source was, so it wasn't something that somebody just created at their desk. It actually had the data source driven off of it, and that was a piece where some of the stuff that we were seeing come out of headquarters, we just couldn't replicate, and so that became part of the dialogue. Is we couldn't replicate some of the cases or the numbers that they were sharing. So certainly something to improve upon in the future.
Yeah, I'm with you 100%. It seemed like sites and then whoever was doing the gating criteria analysis for headquarters were often pitted against each other. So it really is, a takeaway that we need to step back and have one line of communication. And for that, with that being said, I felt pretty confident at the site level. I had my ear to the ground and I was in daily contact with the local public health authorities and had that real live data. So I'm glad that you hit on that. So that really uses all of our time, Paul. Before I turn it over to you, I want to thank the panel. It's been a great discussion. We probably could have done this for the next 2 or 3 hours and still not gotten through all of it. So I appreciate all of you. Great discussion and looking forward to continuing these conversations in the future. Paul, I'll turn it over to you.
Yeah, thank you, Daniel. That was a fascinating session. I want to thank all the panelists for your time, especially Martin and Scott. You guys can maybe get to bed before midnight. I want to remind you that this presentation was recorded, and it should be available as soon as the session is over, and it will probably stay available for quite a few months. If you want to look back or refer some of your coworkers to check it out, just go back to the app and click on this session and the replay will start. Also want to remind you to give us your feedback on this session. We use that feedback for planning for next year, and it also confirms that you attended and if you need credit for attending this session. That's about it. I wanted to also mention that there is a presentation that's coming up or just starting now from EA33 on lessons learned in their assessment process. And join us tonight for Keyword Bingo. It's a lot of fun, and there'll be some fabulous prizes. So that's about it. Thank you again. Thank you for attending. And with that, we'll sign off.